Welcome to What Matters Gulf Coast, episode 67, Sunday, September 4th, 2022.
Our guest today is Mrs. Aisha Davis-Williams. Now, before we get into Mrs. Williams and why she's here, we're going to talk a little bit about her. Now, she's had 20 years of experience of providing social work services to underserved and indigent populations in the southern region of Alabama. But her greatest passion is volunteerism within the Black community. Her work experience includes, but is not limited to, sickle cell disease, aging population, medically at-risk populations, and persons living with HIV and AIDS. She is a native Mobilian and understands the interworkings of how to navigate systems within this community. And we are so happy to have you here today, Aisha.
Thank you, Ms. Susan, for that introduction. Again, like you stated, I've been working in this region in the healthcare setting for a little bit over 20 years. And throughout those years, I've seen some things that, were very disheartening to me, especially things such as the mistreatment of people that look like me. That was one reason why I decided to continue to fight, to continue my professional career in those settings so that I could be an advocate for those underserved and, again, those people that look like me. Recently, I've come back to working in the HIV and AIDS community. I started out working in HIV and AIDS in the late 90s, and that's when it was a real stigma, real hush hush thing in the Black community. I'd never forget being asked questions. Was I HIV positive? Why did I want to work? With that community. And I'm gonna be honest with you, being in that community, helping those people brought much joy, and it was a great need. What's disheartening to me, though, is some of the stigma that I saw 20 years ago still plagues our communities today. And because of that, we're starting to see an increase of infections again. And the thing about it is that people are not really talking about it. So I want to thank you for allowing me to come on, because it is my desire, it is my passion, and something that I've even been talking to with my coworkers, that we need to get out. We need to start talking about what's really going on. Since the mid 2000s, or I say the beginning of 2000, as medications became available for people living with HIV, and people started living longer and healthier lives, what began to happen is, we started to see a decrease in education being pushed into the community. Now, I don't know about anyone else, but I know what I see, especially when I stepped away from HIV. I would often see commercials where I would see them targeting men who have sex with men. And let's be honest, they are the leading population and community that's impacted by this virus. But however, let me give you some numbers. Since 2018, we have seen a major increase again, in HIV infections. Black women constitute only 13.8% of the national population. In that increase that we saw amongst women, it was right at a 20% increase for women, which is small because it was mostly men that had sex with men. That was the greatest increase. It's still been kind of staying the same. However, in that small percentage, guess who was mainly represented? Black women at 60%. That's a concern for me. even though we are a small population, still we are being impacted by a virus and nobody's talking about it. Just because medications are out there and people are living longer, that does not mean that we should not be out here educating people, still providing prevention and letting people know that this disease is still out here and it's still real. I mean, I was thinking about this on yesterday, because as I age and we do, we get new diagnoses, and I'll never forget when my parents were trying to warn me about my eating habits and other things, and I just wasn't listening. If I could do it all over again, I would. Who wants to get up every day and take 2 and 3 pills? So I look at my clients that I'm serving. Not only do they have to deal with a life change, because when you become infected with HIV, it's a serious life change. It's an ongoing medication regimen coming to and from the doctor, making sure that you're staying compliant if you want to live, because the medications that are out now, people are no longer dying from HIV. They are living, but it is a life change. And if you can avoid it, why not? My thing is, though, what we've been finding is that, women and Black women in our population are hard hit with this because we have so many things and so many barriers, I'll say, that complicate the issue. Most of the time in our urban areas, we're dealing with a lot of poverty. And with poverty, especially as Black women, we can count back to 400 years. We've been carrying this nation on our backs, right? And that's the last thing we think about is ourselves. And that's something that I want to talk about. It's time for us to start thinking about ourselves and taking ourselves and putting ourselves first, okay? We take care of everybody else, the children, the husband, the boyfriend, or whatever, but we don't think about ourselves. And we're always the ones that at the end, we get the short end of the stick. Right. And I think that is some of the things that we're seeing, with this epidemic. I mean, it's still here, guys. The numbers are out there. It's just that people are living now. People aren't dying. So it's not flashing all over the news. Not targeting our community. It's still just targeting men to have sex with men. But please, guys, ladies, take care of yourself. The main things that we need to do, get tested. Know your status. One of the things that they were saying, besides poverty being an issue, the issue of stigma. A lot of times when we're out in the communities trying to encourage people to get tested, people shy away. Why? Because it's such a stigma on HIV. No, that's not me. That couldn't happen to me. But it's like 1 in every 9 people are infected with HIV and don't even know it. Just walking around and don't even know it. I've seen TikToks where females are talking about living with HIV for 2 and 3 years before they even start seeing any kind of manifestations. And when I say manifestations, those are things or symptoms that usually kind of trigger or signs that make people kind of run to the doctor and say, hey, what's wrong with me? And many times they see those symptoms and have those signs, but they kind of chalk it up to, oh, it's just the flu. I got a little cold. And you're still walking around positive and possibly spreading the virus. That's the issue. We need to really wake up and know that HIV has gone nowhere. It's still here. It's wreaking havoc on our community. And we need to do something about it. We need to talk more about it.
All right, Miss Williams, I want to ask you a question based on that. You've given us a lot to think about when it comes to HIV and AIDS. The concern for me is the lack of awareness of the symptoms is one thing. Also, now, what is the medical community doing to help this? I mean, because people are still getting infected, but you said that it's all of the advertising and the awareness efforts that have been done since the 90s has been pulled back. Why is this? Is it because they have new drugs and things?
Well, it's still out there because we see to a certain degree. I guess I paid attention because I've worked in that area, but I noticed the commercials about new medications. For about 10 years, they've had what they call PrEP. And PrEP is a medication that can be given or taken by a negative person to prevent the spread of them catching HIV. And it has over a 90% effective rate. However, when I see those commercials advertising PrEP, guess who they're targeting? Men who have sex with men.
Have sex with, right. I've seen them. Yeah. There's a ad displayed on Sage Avenue here in Mobile, between Dolphin.
I don't like to make things, and I try to stay from making things a race thing. I really, really do. But it's so hard to, especially in this day and time, because it's been put in our face. In so many different areas, it's been put in our face. And that was one reason why I was kind of glad that I was able to come back to serve this population, because even in my position, my current position, that was one thing that I said, not that I'm not going to focus on my men who have sex with men, because I do. I love that population. I believe that they are hard hit. They deserve just as much as the other person, but we do too.
I do.
Okay.
Definitely do.
If the dollars can be spent to target them, then y'all need to come in my neighborhood and target my folks too. You understand what I'm saying? And that's where I am.
I agree. One question. Now, we had a conversation before about the ages of these women who were being affected, and you kind of enlightened us on something that was kind of shocking. It was shocking to know that there was a growing population of the elderly. So talk a bit about that.
Well, so I looked at those numbers too, and of course our 20 to 40 is hard hit, especially that 20 to 30 more so is very, very high. And that's a difference. Now, I started seeing that trend in the early 2000s, because I remember the days when we started getting high schoolers, and public health was at one of the local high schools, because it was just so many different contacts, and because that's what we have to do in HIV. When I worked in public health, if you track one person down as HIV positive, you have to go and try to find the contacts, and test them, and that kind of thing. And so I started seeing that, and I've had clients as young as in high school, sad situation. And don't get me wrong though, now in the 90s I had babies too, but they were born from HIV. But that has changed because of the medication. Women are not getting, women, it's not that they can't, but they're not at the rate that they were years ago. It's very slim chance that even a woman with HIV, if she's on medication, that baby will come out negative. But when I was first around, I was still seeing babies born with HIV, but getting new infections of, people in high school. But that's not the bulk of them. We still have some. The main number is that 20, I'll say 20 to 30 range. 30 to 40 is still there. Now, I'm going to tell you what's startling in the community that we often forget about: our Asian population.
Yeah.
They lag right behind. And those numbers have increased. I was so shocked coming back to HIV and looking at some of the rosters and seeing elderly people who were new infections. New infections. And that's the talk. I went out to a physician's office, one of the community health partners, and this is a small clinic that's new, and they serve aging populations. And I was talking to their head practitioner, and I was inviting them to an educational event on prevention. And they were saying, "Oh, we pretty much serve the Asian population." And I said, "Yeah, I understand, but they get HIV as well.
Yeah,
They're still having sex." After the creation of Viagra and Cialis.
yes.
And I mean, let's just be honest. You have aging women who will get with a younger male.
Yeah, that's true. That's true.
But we're seeing, that age group too. The only main difference I can honestly say, coming back after right at 13 years, because I left out of HIV in 2010 when I worked with public health. Coming back, the difference is, the major difference is I'm seeing a lot more people. A lot more people are in care. People were really hiding back in the days. Scared somebody was gonna know. So people do know and understand that the medication regimen is better and more effective than what it was. People are coming in for treatments. However, I'm seeing younger people, I've seen older people, and they're living longer. So you never know who it is. Years ago, people used to say, "Oh, that person's losing weight," and they could kind of assume. You can't do that anymore now. I got a little weight on me. I have clients buy 3 sizes of me because the medications are good. So you don't know. Okay. And that's why I tell people, even in the dating scene, you call yourself playing around, you can't, this thing is real, because nobody is walking around with a stamp on their head saying that I'm HIV positive, and I don't blame them.
Yeah.
And as much as I do believe that disclosure is the right way, let's be real. People are not going to self-disclose.
Yeah.
I mean, some people will, but some people still have that fear of rejection. And then if you reject me, that means now I ran a risk of you going out there and telling others of what I'm going through. So are they really going to self-disclose? No.
That's right. They're not.
No. So we have to be vigilant about ourselves and our own health. If I had not started out working HIV, and it's the truth, if I had not started out working HIV, at an early age, I probably wouldn't have known to the extent and been as vigilant, about my own care. I'm just going to be honest with you. I tell people, even though I work in the healthcare industry, I can be one of the most non-compliant patients. Actually, a research study was found that most people who serve in the healthcare field, they're more non-compliant than the patients.
Just like the hairdresser and her hair, and the seamstress in her clothes.
Yes. So they're looking at, especially when they talk about African American women or Black women, Black American women. Some studies are being done about behavior interventions, because a lot of these bad choices we make, they don't stem, they don't start from one just thought of, a quickie. They just kind of stem from bad behaviors. Society, things in society that, hey, if I'm out here struggling, we talking about poverty, and and I'm a single woman and I have 3 kids at the house, some women just do what they need to do to make sure they can pay a bill, especially right about now, how high things are, And so a lot of times with these behavior interventions now, what they're talking about is, teaching women how to negotiate, not just assume that you have to accept whatever from a man.
Oh, that's a different take on prevention.
Yeah. Because the thing about it,
because
because the thing about it is, it's happening, right?
Right.
It's happening. We have sex workers, and that's one thing about it. For years that was something that we kind of shun and all this kind of stuff. We don't do that. I mean, hey, trade. That's what some people have to do to survive.
Yeah.
I might not agree with it. It might not be my way, but it is what it is. But at least let me teach you how to be safe in doing your trade.
I like that. So you provide condoms as well? I'm assuming yes.
We provide male condoms, female condoms, whatever. Yeah, we do. We provide those items at clinics. I mean, there are several clinics throughout Mobile County with primary health, with the Mobile Public Health Department. You have AIDS Alabama South. All of us partners have those items that are free of charge to the community.
Okay.
Also, I really encourage people to look into PrEP. PrEP is a wonderful thing. And right now they've come out with a new injection where you can take a shot every 2 months. Okay. And I'm saying this medicine has a 90% effective rate. I'm just going to give you an example. And, I was so proud of my worker that day because a gentleman came in wanting condoms, and his thing was that, him and his baby mother, they had broken up or they were on the outs, and, and he said, but, I know we're going to get back together. But I'm coming in to get condoms because I don't want, when we get back together, I don't want to bring her nothing. So he was being straight up, right? And so the worker started talking to him about PrEP. Okay? Because see, one thing about it, and I can say some of these other viruses you can get rid of. You ain't getting rid of HIV.
Right.
Okay?
That's
so
right.
At least with this method, you can be reassured that, hey, this is one serious one that I'm eliminating out of the possibility.
Interesting. My next question, let's see. And I'm thinking about this with the classes that you offer. I mean the talks, I guess, that you offer to help the young ladies negotiate, as you said. Is that one-to-one, or do you offer group classes for something like that?
We are not there yet. We're not there yet. I am, just like I stated, I am back to this arena. This is some of the stuff that I've been looking at that has been done in other areas, other states. Ms. Susan, I am just big on forward thinking. I think that so much, even especially in our area, we are so reactive in our neighborhoods. When things have gotten bad, that's when we get together and get in groups and try to figure out what we're going to do to fix the problem. Let's fix it when we know it's escalating and getting to that problem. Getting to that point. So those interventions and behavior interventions are actually something that I've just been researching that is being done in other areas.
Okay.
And yes, it is something that I am interested in to bring in here to Mobile if possible. I'm also trying to network with other groups in Mobile that are already and have been doing the work, So some people may already be doing this. I just haven't heard it locally. Mostly what we're still talking about in Mobile is pushing testing, and encouraging testing. And most of our grant monies and the monies received through prevention, that's what they push. Testing. Okay, which is a good thing. But for me, I guess I'm an out of the box kind of person. I said to myself, we've been testing since 1990.
What about the mindset, right? We got to work with the mindset of the people.
Yes, we've been, and I guess that comes from me, and that's the social worker in me. Because really, if you don't change behaviors, nothing will change.
Exactly. Exactly. Show a person why their behavior is resulting in the thing that they don't want.
Mm-hmm.
Okay. Then maybe they'll change the behavior. So this
Correct.
is a direct result of what you're doing. So if we can show you that before it even happens, then maybe they'll change the behavior. It's something I think should be introduced, because the hindsight in this case doesn't have to be hindsight.
Mm-hmm. Mm-hmm.
Foresight.
It's so funny how God works. I'm a believer, and
Me
it's just
too.
so funny how God works. Before I had
Too.
even come back to HIV, I was working over at sickle cell, and I was working with peds and adults.
Mm-hmm.
I'll never forget when I was working over there at the peds and peds side of it, and I was talking with the nurse practitioner and one of the physicians, and I had said that I had two young males that was obvious that they lived an alternative lifestyle. Or I'm not going to say alternative lifestyle. The correct thing is they were hiding who they are.
Mm-hmm.
Okay, because we have to embrace all people, all
Mm-hmm.
people.
Mm-hmm.
Now, at the social worker in me, try to talk with the grandmother and just what we see in many of our lower income homes, black family homes. Grandmother is raising the children,
Right.
and in both cases, this was the situation. Both kids live with their grandparents.
Mm-hmm.
One in particular, and I knew that grandmother was having a hard time. I really talked with her, and because I could see it coming, I wasn't even so much overly concerned that, oh, this young man is going to come out that he's gay. I was concerned of his risk.
Wow.
And I started trying to, deal with them on behaviors. Even in one of my classes, which, I used to make sure that the parents signed off on it. But I had sex education classes and we discussed those kind of things, okay?
Mm-hmm.
Healthy behaviors, negotiations, that kind of thing. And when we're talking about negotiations, when someone's saying, hey, I don't want to use a condom, but you need to use one.
Mm-hmm.
What do you do? How do you handle that situation under pressure? And we have such a need to be accepted.
Mm. Yeah.
How do I negotiate that when
Yeah.
I need that approval from you? So, needless to say, the one grandmother was, she always sent her grandson, to the class. The other one was totally, oh no, forget that. We're not doing that.
Mm.
That young man, before he turned 18, ended up HIV positive.
Wow.
Okay. Education and behavior interventions
Mm-hmm.
are a must, and especially amongst our people.
Yeah.
Okay.
Yeah. Okay.
So, you have any more questions?
Well, I must say this has been really great, and I love your passion for what you do. I believe God has blessed you to really do a great work in this area. And
Mhm.
I do pray that you're able to do more. That well, my next question, I would say, how can we now, with this information, impact the community more? Now, our audience is going to see this and
Mhm.
hear this. So these are going to be maybe your last comment on this, I guess. And our audience is going to see this and hear this. What would you say to the person right now who's about to make that decision to be risky? And knowing, being that the age range you're saying 20 to 30s and 40s, that they have no knowledge or no sense of, and I'm just talking rant because I'm gonna cut this up,
Mhm.
but they have no sense of it being a danger to them, because the mindset, right? You
Mhm.
know that they're oblivious to it. What would you say to them? Because they're listening, they're watching. What would you say to that person? to help them not catch this disease unnecessarily?
What I would tell, let me go here and say this. What I would tell the younger me, love yourself. Be aggressive about what you want for yourself.
Mm-hmm.
You know, what feels good for a minute may hurt you for a lifetime. It may hurt you for a lifetime. I just know that from experience, I know that it's just not worth it. One night is not worth it. Be educated. Ask questions. Don't be ashamed to require certain things from your partner. It is too many free HIV tests running around here. I mean, years ago it was hard. They were putting them on the market. They cost $40. Clinics are testing for free. We provide free at-home tests. Test your partner. Make that a part of it. Hey, before we do this, we gonna get tested. And I'm gonna be honest with you. Even before I got married this last time, and I was in the dating circle. No, it was not always easy. Guys thought I was a little crazy. What you mean? You think I have HIV? No, but I just want to make sure I don't get it. But I was just that serious about it because what I knew was that I wanted to live. Because back then it was truly about deciding between life and death. However, even now, I still, and I will say this, and I will tell you many of my clients and some of my friends, because I have friends that are living with the disease, they will tell you if they can do it all over again, they will make a different decision. So be mindful.
Right. Okay. Well, thank you so much, Aisha Williams or Davis-Williams. I do appreciate you being on our show today. I think you have given our audience a lot to think about. And so we're going to carry this message on and allow them to hear it. And I'm going to probably replay this again. And again and again and again until everybody can hear this, okay? Because it was very valuable to us and very valuable to our community as a whole. So we thank you and God bless.
Thank you.
All right. That's the end, dear.
All right.
Now, anything that was so good, but I'm like,